Welcome to this explainer. Today, we're going to pull back the curtain on the invisible, digital, and financial machinery running behind every single doctor's visit. You know the familiar routine, right? You walk into a clinic, hand over your insurance card, see the doc, and eventually you get a bill. But what is actually happening in the background? Well, we are going to demystify the complex, synchronized dance of electronic health records and revenue cycle management. Let's dive in. Here's our roadmap for this session. We'll follow a patient's journey chronologically, starting at the front desk, moving into the exam room, decoding your health insurance card, and going all the way to the final medical bill calculation. All right, Section 1, Story meets Money. Because healthcare administration isn't just about medicine, it's actually a fascinating dual process operating at the exact same time. Healthcare administration is really defined by this dual reality. On one side, we have the human element, the medical mystery. Every patient tells a unique clinical story. But on the flip side, we have the stark reality of the financial transaction. Electronic health records, or EHRs, have to perform this incredibly difficult high-wire act of capturing both worlds simultaneously. They have to document your health history perfectly while also making absolutely sure the provider gets paid. Because of this, you can't just think of the EHR as a glorified cash register. When the clinical side and the financial side communicate perfectly, it creates a seamless flow of information. And the ultimate takeaways here? Better care coordination, much tighter data security, cost savings, and ultimately improved patient care. That brings us to Section 2, the patient workflow. Let's trace a hypothetical patient's journey to see exactly how these systems capture data at every single step. To really visualize this, let's break a clinic down into 3 distinct zones. First, the front office, handling patient registration. Second is the middle office, where your actual clinical treatment happens. And finally, the completely out-of-sight back office, which manages the complex world of billing and the revenue cycle. Let's dive into that first workflow. When you arrive at the front desk, the staff aren't just saying a friendly hello. They are actively using the EHR to verify your demographic info, capture your insurance data, and process your upfront copay. It's only after clearing these financial checkpoints that you're marked as ready, alerting the medical staff in the back. Now, as you step into the exam room, our middle office, the clinical narrative takes over. Nurses and providers are entering your vitals, medical history, and physical exam details directly into the EHR. The system is actively translating your physical symptoms into standardized digital data. This is crucial for diagnosing you today and for billing the exact level of service later. And hey, if you need medication, e-prescribing triggers a highly efficient separate workflow. The EHR doesn't just ping your pharmacy, it electronically checks your pharmacy benefits in real time to ensure the drug is actually covered. It's basically a background check designed to prevent a massive headache for you when you go to pick it up later. Okay, let's pivot slightly to Section 3, Financial Counseling versus Revenue Cycle Management. We're going to contrast the administrative tasks that happen at the very beginning of your visit with the ones that happen at the end. It essentially breaks down like this. Financial counseling happens up front, at the front desk. It's a preliminary assessment to check your primary payer and grab that initial copay. Revenue cycle management, or RCM, well, that's the heavy machinery in the back office. It is far more comprehensive, handling complex tasks like final eligibility and the exact order of benefits to make sure the practice actually gets paid for what they did. Now, the technology that makes this seamless front desk experience possible today is called real-time eligibility, or RTE. Before modern EHRs, staff literally had to call insurance companies on the phone or wait hours for faxes just to verify your coverage. RTE replaced all of that, instantly pinging the insurance network the exact moment you walk in the door. Then there's clinical pre-authorization, a term that usually causes some groans. This is when the insurance company demands to approve an elective procedure before it even happens, just to guarantee payment. If the back office fails to secure this green light through the EHR, the claim can be outright denied, leaving either the practice or you footing a massive unexpected bill. So speaking of insurance companies, let's move to Section 4, Decoding Health Insurance. Let's get practical and decode that small piece of plastic that drives all of this math. When you hand over that piece of plastic, the specialist isn't just looking at your name. They're scanning for critical data points that unlock the entire revenue cycle. Your member ID, specific plan codes, and your exact co-payment tiers. Every single number on the front of that card dictates the math that follows. And then there's the back of the card, the side you probably never look at until something goes wrong. It lists payer websites, routing addresses, and dedicated provider phone numbers. When a claim gets denied and the back office runs into a wall, this fine print is exactly what they rely on to resolve the issue. So, who actually pays the final bill? Well, it depends heavily on the program. For employer-provided insurance, the cost is shared between the company and you. Medicare, primarily for folks 65 and older, is a mix of federal and individual funding. And Medicare relies on federal and state funds based on income guidelines. The EHR automatically adjusts its entire billing workflow the second it knows which of these payers is on the hook. But honestly, the most vital term for your own wallet is the out-of-pocket limitation. This is the absolute maximum amount you could possibly pay in a single year for covered services before your insurance takes over 100% of the costs. The EHR meticulously tracks every single dollar you spend to ensure you never pay a cent over this limit. All right, let's move to our final section, doing the math. We're going to put everything we've learned together and actually step through the complex billing math for a single typical office visit. Okay, we will start our example with a base gross charge. Let's say the standard fee for today's office visit is $200. Remember our workflow? The front office collects a flat $20 copayment from you upfront, before you even see the doctor. That $20 is subtracted from the total, leaving us with a remaining balance of $180 that needs to be settled. Now, the mouth moves to the back office. Assuming your annual deductible is already fully met, let's say your specific insurance plan dictates you owe a 10% coinsurance on that remaining balance. 10% of $180 is exactly $18. That becomes your final responsibility on the back end. Let's summarize the math here. You, the patient, ultimately pay $38 total. That's the $20 upfront copay plus the $18 back-end coinsurance. The insurance company covers the remaining $162, completely settling the initial $200 charge. This perfectly illustrates how the EHR effortlessly juggles multiple simultaneous streams of revenue to close out just a single 15-minute encounter. Now that you've seen the intricate flow of clinical data and dollars, literally from the moment you step through the door to the final calculation of a medical bill, how might this change your perspective? The next time you walk up to a clinic's front desk and hand over your plastic insurance card, you'll know exactly what kind of massive digital machinery you just set into motion. Thanks for joining me on this explainer, and keep asking questions.